Hello everyone, my warmest greetings to all of my tutors, TAs, and classmates. I'm Phúc, number 37, and this is my answer to the warm-up activities part 1, 2, and 3. So today we're going to talking about dementia. So this is a syndrome that describes a gradual decline in memory, thinking, and social abilities that is severe enough to interfere with daily functioning. Discussion identified the four most common causes of dementia. So there are many there are many diseases that could lead to dementia, but here's the top four common causes. The first one is Alzheimer's diseases. The second is vascular dementia. The third is Lewy body dementia, and the fourth is mixed dementia. And question number two, apart from impaired memory, what are the symptoms my patients with dementia present? So, dementia symptoms can vary depending on the cause. So, there are two major changes when the patients have this syndrome. The first one is cognitive changes, and the second is psychological changes. So, the cognitive changes, which include the impaired memory, which is memory loss, and another symptoms may be also can be included is problems communicating or finding words, trouble with visual and spatial abilities, problems with reasoning or problem solving, uh, trouble performing complex tasks, and confusion or disorientation. Uh, about the psychological aspect, some patients may suffer from personality changes, depression, anxiety, inappropriate behavior. Some may be suspicious, which is known as paranoia, or they can see things that aren't true, which is known as hallucinations. And question number three, name three conditions with dementia-like symptoms that are reversible. So uh, there are some symptoms that can act like dementia, but it's not, and all of the symptoms can be reversed with treatment. So the first one is infections and immune disorders. So uh, when a person have an infection or they suffer from immune disorders, the body has an attempt to fight off these infections, and this can cause the body's immune system to attacking nerve cells, which can also can cause dementia. The second thing is metabolic or endocrine problems. So people with thyroid problems or low blood sugar can develop these dementia-like symptoms. Uh, the third The third condition is low levels of certain nutrients, and so when a person do not get enough certain vitamins or minerals in their diet, and they can develop the dementia symptoms. So some vitamins that are vital is vitamin B1, vitamin B6, vitamin B12, or vitamin E. So let's include question number 4 also. And question number 5. Numerous risk factors contribute to dementia. Identify 5 risk factors you believe hold greatest significance. And risk factors that can contribute to dementia. But for the risk factors, they can be divided into two groups: risk factors that cannot be changed, and risk factors that a patient can change. So, and the five risk factors that I think that can have the greatest significance to this syndrome is aging, because when you age, the risk of dementia also rise higher, especially to some that age from 65 or older. And for the second risk factors that I think that's also important is diet and exercise, because some studies has found that people at the higher risk of dementia who can who follow a healthy lifestyle can lower the risk of the cognitive decline. And with a balanced diet like protein, vitamins, mineral, vegetables, and exercise daily, and their the function of the brains will also be improved. Uh, is drinking too much alcohol. So when you consume a large amount of alcohol, your brains will have some changes, and these are often negative changes. It can impair the function of the brain. And several large studies and reviews found that alcohol use disorder were linked to an increased risk of dementia. Uh, the fourth is cardiovascular risk factors, and this can include so many diseases like obesity, high blood pressure, high cholesterol, or building up fats in the artery walls, and diabetes and smoking are also cardiovascular risk factors, and this can develop the risk of dementia, especially if the patient poorly control these risk factors. Yeah, and the final, the fifth one I think is um, maybe sleep problems. So people that do not get a full of sleep, or the quality of sleep is not well, they can have a sleep apnea, and the disturbance of sleep can put them in a higher risk of developing dementia. Sixth question: how can you take measures to safeguard yourself and your family from developing dementia? Uh, so there's no way to like prevent dementia completely, but there's some steps that can help to like alleviate the symptoms. So the first one is keep your mind active. So when you stimulate your mental like doing some activities like reading, solving puzzles, playing chess, playing word games, you can decrease the effects of dementia. And you also need to be physically and socially active. So when you do the physical activities daily and you interact with your friends, your families, your coworkers, this can delay the onset of dementia or reduce the symptoms. And if one of my relatives or one of my friends that smoke, I would tell them to advise them to quit smoking, because some studies have shown that smoking in middle age or beyond might increase the risk of dementia. And when talking about the nutrition, I would advise my friends and family and also myself to have a balanced diet and get enough things like vitamin D, but um, it's vitamin D intended for preventing dementia. And if uh, you have some other cardiovascular risk factors or health conditions, you need to like go to the doctor, visit doctors monthly to manage all of the conditions that you're having, and this would help you like lower the cost of lower the risk of developing dementia. So that's it. That's my answers for all the three parts of warm-up activities. Thank you for listening.